Hi guys, happy Sunday to you all. I'm just coming back from church. How do I look? Me and this might look safe all the time. How do I look? Okay, see guys, I promise you one thing, right? Anytime you see me on your screen, I promise you're going to learn something new from me that day about health insurance coverage. Okay, just like in our previous videos, we've been talking about health insurance, and there has been testimonies. So there have been testimonies. Don't worry, very soon I'll put some of the testimonies that I've been receiving. But today, let's just go through the advantages. People don't really know the advantages associated with this health insurance coverage, because money is also involved, but they feel like since money is involved, there's no advantages. I'm going to list out some of the advantages. The advantages are plenty, is very much, but let me list out some of them for you to know that we are not joking. And when I say health insurance works in Nigeria, it actually works. You're getting it from the right source. It actually works because I'm into health insurance and I can tell you categorically that it works in Nigeria. So one of the advantages is financial. It provides financial protection and affordability. What does that mean? It protects individuals from massive unexpected medical bills. When you go to the hospital, let me give you an instance based on your location, but where I am currently, that is Lagos, Nigeria. Let me tell you something. For you to walk into the hospital right now and say, oh, you want to see a doctor, and maybe you have headache and malaria symptoms. You guys, everybody in Nigeria knows the malaria symptoms, not even past the doctor self. So if you just walk into the hospital, maybe you're feeling somehow and you want to see the doctor. Just to see the doctor for malaria and then get drugs and everything will not cost you anything less than 30,000 naira. And you may actually have that money, but you may be feeling down with fever and everything, and you needed to see a doctor. But you don't have that much amount of money in your pocket at that moment. Not that you cannot provide it, but at that moment it's not really available. Then you start running health care. You may decide, oh, okay, since it's malaria, let me just go to over-the-counter drug and then collect some drugs. And then after taking the drugs that you bought over the counter, you bought from Mama Nkechi chemist, the malaria is still there. It's not going because there are some series of tests, right? There are a combination of medications that you need to take to make the malaria to subside. But when you decide to go to Mama Nkechi chemist to get a paracetamol and artemether, it's not just enough for malaria, okay? So these are the things that health insurance does. That's number one. Number two is gaining access to reputable health provider. That's hospitals, both private and public. And you're gaining access to some specialists or even all the specialists. That's when you needed the special care. And also for laboratory investigation. Remember, there are different kinds of laboratory investigation. We have high-tech lab and we have ordinary laboratory investigation. Even some x-rays, and that's radiological aspects and all that. So these things, it's not all that is really affordable. Let me take for instance what we call MRI, that's magnetic resonance imaging. It is done for maybe if you're suspecting brain tumor or any form of tumor in the body that CT scan is not able to see. And this kind of investigation, even the CT scan, that's computed tomography investigation, they are quite expensive. Only the MRI is ranging about 100 and something thousand just to do the MRI. Same thing with CT scan and all their radiological investigation and laboratory investigation as well. But when you are under insurance coverage and your coverage covers for these investigations, you don't need to think about them when the need arises. And you never can tell when the need will arise. So we should always be careful with our health and then know what to do when the need arises. Now, the most common aspect is this one I'm going to talk about now is very common between Nigerians. We like over-the-counter drugs a lot. And I understand Nigeria is very, very difficult. The economy is not really smiling at all. So anything that you can do to survive and be healthy, even if it means going to Mama Nkechi, Abi, Mr. Oko chemist to just get those drugs. This health insurance will help you to reduce over-the-counter drugs because you will not have any need to go to Mama Nkechi chemist to go and get that paracetamol, that's a artemether, where you can easily walk into your hospital, tell the doctor your history, explain how the symptoms are, and the doctor will diagnose you. There's investigation to do. The doctor will do the investigation and get the accurate diagnosis and give you the accurate treatment. So there will be no need for over-the-counter drugs. You see that advantage, right? It is massive. So 4 is preventive care and early detection. So some coverages often cover for routine checkups. In one of our previous videos, I explained to you guys, or I informed you guys that I was going for my annual medical check. And after going for the annual medical check, one of my results was saying something that I don't understand. Only that result understood what it was saying. So because of that result, I had to go and see my physician, and my physician now wrote that I should go and do another investigation that will explain proper what is going on in that particular organ, that is my heart, which I went to do echo, and God so kind, the echo came out very okay. So it happened that I had no issue. So if at all that I'm not covered for routine medical check, there could be a problem in the heart that I may not be aware of, because someone like me cannot even just get up and say I want to go and do ECG, I want to go and do echo. I hate hospital. Somebody like me cannot just wake up, but because I'm covered for it, I'm not going to pay for it. I make advantage, I make use of what I'm covered for. Do you understand? So with this, you can be able to dictate early illnesses. And also for some people that have been trending online negatively, that claims they have cancer stage 4, from not knowing that you have cancer to becoming stage 4 cancer, which is the highest stage of cancer. So if there's anything like a annual medical check, those people would have realized, even though it is a lie, it's a blatant lie from the pit of hell. May God have mercy on those kind of people. But even though, had it been that the cancer claim it was true, and I pray it becomes true, because whatever you ask from God, that is what you receive. You cannot just deceive public. Let's focus on the video. So even though it is true that the person had stage 4 cancer, routine checkups would have detected that cancer earlier enough, and then treatment. So the treatment will start early enough. It will not be that easy for that cancer to get to stage 4 and metastasize, because before it will get to that stage 4, it could be mastectomy, radical mastectomy, that is a total removal of the breast may have been done, and there will be no way, or the lymph nodes that we are affected, or the cells that we are affected, will have been cut off, so they cannot be able to spread or metastasize anymore, because where they are living, their home of abode has been removed, cut off from the body. Do you understand? So early dictation is very important. Also, childhood immunization, that is also a part of early dictation of any childhood diseases. And there are 6 childhood killer diseases that immunization stops, immunization prevents. So immunization is also part of the coverage under the scheme. Now number 6 is coverage for serious illnesses, right? So it covers essential expensive illnesses such as surgeries. Surgeries are also known as operations. Now let me give you an example of surgeries. Cesarean section for pregnant women that have reached that are due for delivery, but maybe they have reached presentation, or there is a complication with the pregnancy and they have to undergo surgery in order to give birth to the child. So cesarean section, and then those kind of surgery, those big surgeries, and what we call laparotomy, different kind of surgeries, these are all covered under the scheme. Okay, so it is not a situation whereby when you get to the hospital, you will be expected to make a deposit before such surgery can be carried on. You just have to call your HMO as long as it's covered under the plan that you purchased. Also, some chronic illnesses like diabetes, hypertension, do you know that going to buy a diabetic drug or a hypertensive drug refill, these illnesses, their drugs are given monthly, and you'll be on this drug. You'll be on this drug for life. As long as you live on this earth, you'll always be taking these drugs in order to maintain your blood pressure level. And these drugs are purchased every month. For a monthly purchase of this drug, do you know how much hypertensive drugs cost? There is a woman that I met at the pharmacy, one pharmacy here in Lagos, I think last 3 days ago. She was just getting 3 drugs out of 6 drugs that was prescribed, and those 3 drugs alone, we are given what she had. I think the amount she said she could pay at that moment was 20,000. That was what was left in her account. And those 3 drugs, thinking that the 3 drugs would be under that 20,000, the 3 drugs were about 38,000 naira. One drug there was 23,000, and the other 2 was about 15,000. So it was about 38,000 on the whole. So she had to go with the other 2 drugs that was under 15,000, and left the most important one that was 23,000. She said she would come back for it because her money wasn't up to that amount. So imagine this woman is under health insurance coverage. She will just be at the comfort of her home, and this drug will be delivered to her at her beck and call. And it will be delivered completely. The 6 drugs that was prescribed for her will be delivered to her at her beck and call. So these are the importance of health insurance coverages, especially for our elderly ones. In fact, for everybody, because health issues are emergency issues. These are not the things that people pray for every day. Do you know that health insurance also covers for emergency cases? Do you know that state of emergency whereby something will just happen that is unexpected? Emergency situations are the situations that happens unexpectedly. You are not expecting it, it just happens. And that is mostly what happens when it comes to healthcare. In our health, we don't pray for us to have malaria, have even those small ailments. They are all emergency, because you are not actually expecting to have malaria tomorrow. It's not like you have booked malaria that, oh, okay, next weekend I'll be having malaria. Then you are not preparing to have malaria. No, it comes all of a sudden. It might even bring you down when you think you've dressed up for work and everything, and the next thing you see that you are feeling feverish, you are feeling weak and all that. You didn't expect it to happen, and maybe by that time you are running out of cash. Those are emergency situations. Or is it the case of accident? You might be on your way to work and something may happen. It may not be you that's affected directly, but you may hit somebody else that you need to take care of, or something might happen to your brother, your sister, your wife, or even your children that you did not expect, even though you prayed before leaving the house. Yes, emergency things are the things that happen. We do not wish for it to happen, but it does happen. So we should live in reality that these things does happen. So when it happens, what do we do? How do we handle this situation? This is where health insurance comes in. When you know that you have a health insurance, you know that you will not be afraid. Although you'll be afraid somehow, but not be afraid of money aspects, right? At least the monetary aspect, you'll be calmed about it, because health insurance will take care of it. Convenience and peace of mind is another advantage of health insurance coverage. What do I mean? How does it come into health insurance? Remember, it reduces stress that is associated with financing medical care, allowing patients to focus on recovery. You don't need to think about how much am I going to spend, how much is this, how much is that. Even when the doctor asks that, tells you that, oh, you should be on bed, on hospital bed for like 3 days, 4 days, so that you recover very well before going home. But because you feel like, the money is going to be much, or you'll be telling the doctor to discharge you against medical will, you'll be asking the doctor to discharge you, and doctor, knowing fully well, because he is a professional in that field, knowing fully well that discharging you is not the best option. But because you too, you may also know that discharging me is not the best option, but because of finance, I don't think I can afford this at this moment. But when you know that you have health insurance, you relax, take the treatment, just focus on your recovery, not the financial aspect, not what the hospital is going to give you or anything. Just focus on getting well and reuniting with your family. That is a very good advantage of health insurance coverage. Now, the last but not the least is reduction of careless death and embarrassment due to lack of deposit before treatment. There is something that happened in the social media some time ago. I think, was it earlier last 2 years, late last 2 years, or earlier last year, I can't remember, that there is this man that his wife died because he wasn't able to deposit 500,000 for cesarean section. It was trending then, and he was trying to cause the hospital, make it look as if it is the fault of the hospital that asked him to deposit. It is not good anyway. Even the private owners of those hospitals, it's not really rosy for them. If you did not pay the deposit, how will they be able to take care of your wife? Where are they going to get the resources that is needed to take care of your wife, take her to surgery, bring out your baby and all that? So had it been that man had or knew about health insurance, or maybe he knew but he didn't put his mind, he felt like, I don't really need it, and then it happened. So had it been he had health insurance coverage, he wouldn't have thought about the hospital that he is covered under. If he goes to that hospital, he wouldn't have even thought about deposit. Even the hospital wouldn't have asked him anything about deposit. They would just contact his HMO, that's Health Maintenance Organization, and collect code, and then go into the theater and bring out the baby, clean the mother and the baby, and the mother and the baby will still be alive today. But because this man did not have any health coverage or anything like that, he was asked to make a deposit, and at that point in time, he didn't have that 500,000. This is the major advantage of health insurance. It avoids out-of-pocket payment. It avoids embarrassment when you're being asked to make a deposit and you look at yourself. You know you needed this care, but you do not have the financial means to provide this care for yourself. What do you do then? Guys, let us make our health our priority. Alright guys, thank you guys for listening. Still me, your girl, Gosta Melowa, aka Nurse Gutsy. Please live a healthy life with me. See you in our next video. For now, bye.